Let's think about something for a second. What does it really mean to be a good patient? Especially, when it comes to mental health care. We've probably all felt it, right? Walking into a doctor's office, there are these unspoken expectations. Like, should you just sit quietly? Nod along, take the prescription, no questions asked.
Yeah, it's actually a pretty deep question when you stop and think about it. And today's deep dive, it's all sparked by an article that really takes a hard look at that exact idea. This traditional notion of the good patient, particularly in psychiatry, but also just medicine in general.
Okay, so the core idea. What's the main challenge the source is putting out there? Because I think for a lot of us, good patient just equals doing what you're told. Compliance.
Exactly. And that's the assumption the article tackles head on, that being good is just compliance, taking the meds, making appointments, not really questioning the advice. But then it asks this really critical question. Does that kind of compliance actually help the patient in the long run? Or is it maybe more about making things run smoothly for the system?
Systemic convenience. That's interesting. And okay, so our goal here for you listening is to kind of unpack that, to get past just simple obedience, understand maybe the psychology behind it, the pressures from the system, and maybe redefine what healing, what thriving could actually look like. We're hoping to uncover some, surprising things, those aha moments that get you thinking differently. So thinking about those unspoken expectations we mentioned, the article kicks off with something it calls the invisible script. Sounds intriguing.
It really is. It's this idea that, like, the moment someone steps into the mental health system, there's this subtle set of instructions, unwritten rules. Things like trust the experts, accept the diagnosis, definitely take the medication often for the long haul, and maybe don't ask too many hard questions.
Right.
What's kind of surprising isn't just that the script exists, but that this script, which probably started with good intentions, safety, stability, might actually end up, well, subtly getting in the way of real healing. By discouraging critical thinking, discouraging autonomy, you might start thinking compliance is recovery.
And as that script is playing out, there's this other layer the article points to, the good patient identity trap. So it's not just following rules, it's becoming part of who you are.
Precisely. It gets tangled up in your identity. And this is where it gets really tricky internally. Imagine a patient starts having, like, genuine concerns about their meds or their treatment plan. But because they've so deeply absorbed this good patient role.
They feel like they're being difficult or ungrateful.
Exactly. There's this huge internal conflict. And it's not just doctors reinforcing it. The article points out it's friends, family, meaning, well, of course, society, even your own survival instincts when you're in crisis. This need for approval, for validation. And it can sometimes mean you don't explore other things, other approaches that might actually lead to better long-term well-being.
Wow. Okay, so that really sets up this next concept the article introduces, a mental model called the compliance insight cycle. It sounds like it explains how people get sort of stuck in that identity trap.
Yeah, it lays it out quite clearly. If you think about the whole picture, it often starts with a crisis, right? Symptoms are bad. Then come compliance. Okay, I'll take the medication. I'll follow the plan. Yeah. And often, things stabilize. Yeah. You feel better.
Okay, makes sense so far.
Then maybe gain some insight. You think, okay, I'm doing better. What else could help? Or maybe I don't need as much medication. So you start exploring, maybe thinking about reducing meds, looking into therapy more deeply, lifestyle changes.
But
then maybe there's a setback or what feels like a relapse. And boom, you're right back to feeling like you're in crisis. And the immediate reaction is often to go back to strict compliance, back to the original plan.
I see the cycle.
And what's really eye-opening here is how this cycle can subtly teach the patient that any step away from that standard path is risky.
Dangerous.
Even.
Yeah.
So it reinforces fear, reinforces dependence on the system, even if that system isn't fully serving your individual needs anymore.
Yep. Okay, so given that cycle, what about the medication itself? How does the article position medication in all this? It sounds like it could be seen as anti-medication, but is it?
No, and that's a really crucial point they make. The article is absolutely not anti-medication. It's very clear. Medication can be life-saving. It can be completely necessary for getting someone stable initially.
Okay. Critical for stabilization.
Critical. But here's the distinction it draws. While it's vital for that initial phase, it often gets presented, almost by default, as the long-term end-all be-all solution. There often isn't enough reevaluation, Not enough discussion about, say, tapering down later, or if it's even still needed years down the line. Patients aren't always given the options or info to assess that.
So the system isn't always set up for that kind of nuanced, evolving care plan.
Not always, no.
Yeah.
It defaults to the initial solution sometimes.
And this leads to another key idea, a distinction the article makes between acceptance and resignation. That sounds subtle, but important.
It is, yeah. Really profound, actually. True acceptance, as the article frames it, is active. It's like saying, okay, this is my situation right now. What can I actively do? What can I explore to really help myself thrive? It's empowering.
Right, proactive.
Exactly. Resignation, though. That's more like, well, this is just how it is. There's nothing else. I just have to live with it this way. It's passive.
And the article suggests people are sometimes led towards resignation, even if they think it's acceptance.
Yes, subtly. And it argues this often happens because the system itself just has limitations, gaps in what it offers or encourages.
So if it's not necessarily like bad doctors or bad intentions, where do these gaps come from? Why does the system sometimes fall short?
Yeah, it's really not about blaming individuals.
Yeah.
The article points out that, for instance, many clinicians just aren't trained extensively in how to safely taper patients off medications or how to create really personalized withdrawal plans.
That's a training gap.
It is. And also, think about where the research money goes. It overwhelmingly flows into developing new drugs, not so much into studying how to safely stop or reduce the ones we already have. So it's less a critique of the people within the system and more an observation about how the system itself is structured. It's not always geared towards, truly holistic healing beyond just managing symptoms.
Okay, so if being a good, compliant patient isn't the whole story, and we need to move beyond that,
Yeah.
what does being an empowered patient actually look like? The article talks about a toolkit, right?
That's right. A multidimensional toolkit for healing. Because sustainable healing usually isn't just one thing. It might include medication, yes, absolutely, maybe short-term, maybe adjusted over time, but then you layer in other things.
Like therapy.
Definitely therapy for unpacking the emotional and psychological stuff, but also crucial lifestyle things. Diet, sleep, movement. These aren't just nice to haves, they can be fundamental. And the article even mentions metabolic therapies, things like specific dietary strategies, like a medical ketogenic diet, done under proper supervision, of course focusing on how the body's energy systems, its chemistry, can impact brain health.
So it's about building a whole collection of tools, not just relying on one.
Exactly. A toolkit that grows with you, that changes as your needs change, not just sticking rigidly to the first thing that worked.
This really does seem to circle back to the system itself, though. You mentioned systemic convenience earlier. It sounds like the system almost rewards that good patient behavior. Why would that be?
Well, think about it from a systems perspective. Systems tend to favor predictability, right?
Easier to manage.
Much easier. Long-term medication prescriptions. Simpler administratively. Compliance fits neatly into pharmaceutical industry norms and, frankly, large institutions. They don't always have the structure or incentives to reward really deep, nuanced, highly individualized care. It's complex. It takes more time.
So the path of least resistance for the system is often the compliant patient on a long-term prescription.
It can lean that way.
Yeah.
And that's precisely why self-advocacy becomes so incredibly important for you, the individual navigating this. You often have to be the one to push for those conversations about what true recovery looks like for you, beyond just maintaining the status quo.
Okay, so let's recap where we've journeyed in this deep dive. We started off questioning that whole idea of the good patient, and we found this invisible script that sort of guides behavior, and then this identity trap where being compliant becomes part of who you feel you are.
Right. And then we looked at that compliance insight cycle and how it can maybe unintentionally keep people feeling dependent, reinforcing fear around exploring options, even while acknowledging, crucially, that medication is often vital, especially at the start. But the system might default to it long-term, partly because, well, systemic incentives lean towards that predictability we talked about.
But it wasn't all about problems. We also talked about that vital difference between acceptance, real, active acceptance, and just resignation. And the power of building that multidimensional toolkit, not just meds, but therapy, lifestyle, maybe even metabolic approaches, all working together, a toolkit that evolves.
Yeah, and the article wraps up with this really thoughtful, almost poignant reflection. It says, being a good patient can feel like safety, but it can also keep us from asking, what does thriving look like for me?
What does thriving look like for me? That really sticks with you. So maybe the final thought to leave you with is this. How can you start practicing more self-advocacy in your own health journey? How can you push, even gently, for conversations about genuine recovery, about evolving well-being, especially if the system seems kind of comfortable with just keeping things as they are? What's maybe one small step you could take, even today, to shift from just compliance towards a more empowered, collaborative kind of care, something to mull over?